Hi everyone. Thank you for staying back for the graveyard shift, as you call it. Um, it's actually an honor to be here, and I'd like to thank the organizers, and especially Sean, and which he's not here, but Julie as well, for getting me here. Um, every time I've done this presentation, it was sort of like a sort of downbeat presentation, but things have evolved, and I'm hoping that through what's happening in Mauritius and what's happened as well and what's happening now, we can learn from that and move forward towards something which is better. Anyway, this is where Mauritius is, for people who don't know where it is. It's a tiny island off the coast of Madagascar. And a lot of people know it for its beaches, but as you will see in this picture, basically now our beaches are being grabbed by private corporations, but that's a whole other debate, and I'll talk to you about it some other time. This thing's not working now. Oh, yeah. I go back to Mauritius. I'm just going to tell you a few things about PILS. PILS was created in 1996, and it's a leading NGO in the fight against AIDS in Mauritius. It's a civil society principal recipient for the Global Fund since 2012, and PILS is also a member of Coalition Plus, which is a consortium of NGOs working in the field of HIV in about 40 countries. And PILS is also a member of IDPC. Basically, Mauritius, in the late 2000s, we had opioid use of 1.95% for a population of 1.2 million at the time, which is one of the highest in the world. And basically, civil society rallied together to advocate for NSP and OST to be implemented. And I'd like to point out as well that at that time, CUT, or the organization I used to work for, and the main NGO that does harm reduction in Mauritius, started the needle exchange program illegally and didn't wait for the government because there was a need to actually address issues faced by the community. Obviously, the programs have scaled up in 2010, and one of the things that happened is we saw a 60% drop in drug-related crime, and also, this thing is not working. Oh, yeah. And 60% drop in incidence of HIV among people who inject drugs. So we can see from this graph that harm reduction actually works. And up until 2013, everything was fine. We were on target to potentially meet the 90-90-90 target set by UNAIDS. But obviously in 2014, something happened. Basically, there was an election in Mauritius, and the government that came into power, they placed the war on drugs as declared in their manifesto. And the first order of the Minister of Health at the time was to decentralize distribution of methadone outside of police stations. It used to be done in health care centers. It used to be done from 8 till 12 in the morning. And when he did that, he also restricted the time from 6 to 8 a.m. in the morning so that drug users don't get to interact with school children. Anyway, that's the guy there. If you ever see him somewhere, just feel free to go in and do whatever you want. Smack him in the face, yeah. But anyway, he actually went on national TV and news and said that methadone is a dangerous drug, and when the state is actually giving methadone to people, they're basically becoming drug traffickers. And when it comes from someone that high up in power, people tend to listen to that. People who are not connected to the field, people who don't know the reality faced by people who use drugs. And so he actually increased stigmatization and discrimination towards people who use drugs. Basically, in 2015, he announced that he was going to stop giving out methadone program, but obviously we didn't stay quiet. So civil society again, we started to advocate, and we regrouped a few people, and we opposed that vehemently. And he wasn't able to stop the OST completely, but he did stop the induction of new people on methadone substitution therapy. But the 4,300 people who were enrolled on MST were kept on MST at the time. But from July 2015 and January 2016, there was no new substitution therapy being offered to new patients. People were getting methadone off black market, but it was mixed with saliva, and obviously people were getting hepatitis C. In 2016 again, they announced the introduction of a miracle therapy of Suboxone combined with naltrexone, and was meant to be a miracle cure. But what we saw was a steady increase to people coming to NSP sites. At the same time, they repealed the NatRaiser Act, which regrouped various NGOs working in the field of rehabilitation and sort of coordinated the response. They scrapped it completely. And NGOs were targeted quite aggressively in the media and also during meetings. Obviously, there was a rise in people coming to the NSP because there was a bad quality methadone, no confidentiality, as you can expect. Hours were not friendly. 6, you have to get up at 5 to get to the station at 6, and if you get there after 8, you can't get methadone. There were a few cases of police brutality, but with the help of the media, we managed to stop that. And as you can see, the figures for NSP at the time in 2014 was 2,092 people, but in 2016 it went up to 3,500 plus people. But the one thing that happened is that the number of syringes and needles that cut the main NGO where this harm reduction was able to get was reduced to about 30,000. So it makes it less than 9 needles per person per month. And also, the government at the time started to ask and demand the identity cards of people coming to the sites of cut instead of using the UIC system, the Unique Identifier Code system, which protects the confidentiality. We didn't cave in, and we haven't caved in, and we won't cave in. An outcome of bad policies, as you can see from a graph there, the HIV incidence among people who inject drugs has steadily gone up we went from 31% in 2014, and it was up to 38.6% in end of 2017. And since the start of this year, from January to June, there's been about 191 new cases of HIV, which is quite high. It's probably one of the highest since 2012. Basically, what we tried to do at the time was we met with the minister and the senior staff. We tried to engage with them in dialogue and talk to them. We got private sector to get involved as well. And we tried to meet different parliamentarians, even in the oppositions, to try to advocate for harm reduction services to still be preserved in Parliament. But all of that took time and effort, and obviously we were successful up to a point. We also had help from international organizations like IDPC, UNODC, UNH, WHO, the Global Fund, OSF, ERASA, and Global Commission of Drug Policy. Ruth Dreyfus came to Mauritius a couple of years ago, and she sadly met with the Minister of Health, who didn't really know who she was and didn't really care what she was saying as well. But really, we didn't give up, and we used multimedia campaigns to promote harm reduction and fight for harm reduction, and that's one of the key lessons I want to actually tell you about today. PILS started a campaign called Can Prison Cure Drug Use, which was in the media, on Facebook. These are the few posters we actually produced at the time, and we also did a series of videos of people who use drugs and how they're living their lives and sort of impact of a negative, bad policies on their lives. And now I'm coming to Support Don't Punish campaign, which has actually been very central in Mauritius because we've used that. For about 4 years, I was the national coordinator for the campaign, and we basically used the Support Don't Punish campaign to create spaces for dialogue, which is extremely important in a harsh environment. I'll show you in a minute how we used it in Mauritius. But basically, the Support Don't Punish campaign is a global live action, which is done on June 26th. It's done on that particular date to reclaim the international drug trafficking date and to push forward the fact that we need to support drug users instead of punishing them. There's about 93 countries who take part in it, and in about 2,005 cities. You can see from map here some of the countries that take part in that. Actually, Mauritius is not even on there because we're too tiny. But anyway, this is some of the activities that were done in 2018, and you can see Harare and South Africa there and different countries. But how did we use it to create space for dialogues? In 2016, when I was working at CUT, organized something called Drugs Over Lunch. And basically, I got people together to eat. And there was about 7 tables, about 6-7 people per table. On each of the tables, there was someone who works in the field of drug, who works in the health sector, basically with drug use. We had an advocate, we had a member of parliament, and we had drug users as well present. So that was the first step to actually get the dialogue going and get people in parliament, policymakers who are not on the street, to actually talk to people who use drugs. We scaled up again, and we did a congress with syndicates of nurses. Again, we exposed what the war on drugs is and why bad policies can impact people. And in that congress as well, we had drug users who participated and contributed on the panels. 2017, we scaled up again and we started working with Council of Religions. Basically, Mauritius is a multicultural country. We've got 6-7 religions. And it does play a big part in how policymakers view things. And we got the cardinal, who is on the left, the cardinal in Mauritius, to actually go, to actually start advocating for Support and Punish campaign. And he openly said that drug users need to be supported instead of imprisoned. That went a long way to actually convince people that what we're doing is actually good for everyone. And also at the time, we started working with drug users, and that was the starting foundation for MONPUD, which was officially launched this year, the Mauritian Network of People Who Use Drugs. And in 2017, again, we did a silent protest in front of Parliament to try to get politicians' attention, and which we did. But going further, with, again, around the Support and Punish campaign, we organized the Mauritius Harm Reduction Conference in 2017, which is actually the third conference on harm reduction organized in Mauritius. And you can see Sean there and Pascal Tanguy, one of the international experts. There was Ricardo Fertis from GATT, and Heijin came from Arasa, Mauritius. And basically, on that conference, we managed to get the Prime Minister, the President of the Republic, the Minister of Health and Social Justice, and several parliamentarians. And it was a space to actually, we had about 300 people who turned up, including quite a large number of drug users. It was a space to, again, create that space for dialogue. And as you can see from here, Sean looking very angry, talking to the Prime Minister of Mauritius. And I think that sort of changed things. Well, obviously, it wasn't this bit that changed things, because Sean was the keynote speaker, and he explained how Mauritius was an example for Africa in implementing harm reduction services. And all of that engagement actually paid off. This is the last Support and Punish campaign I organized for CUT, and as you can see from the picture there, basically we got people from pretty much all the political parties together. There's quite a few political parties in Mauritius, and they don't really have a common voice. But we managed this year to get them together to start a dialogue around drug policies and change we need to actually look forward to because of elections coming next year. And this particular event was around cannabis, because it's actually people talking about that, and we used it to engage them in started talking about cannabis and decriminalization and legalization of drug use. So basically, after all of that, what's happened in 2017 is there was a new Prime Minister, a new Minister of Health, the reintroduction of methadone substance induction, the dialogue with the Minister of Health was reinstated, and we created a link with the Prime Minister's office, especially after the conference where we managed to explain that we know what we're talking about and we need to listen to us. So 2018, the Prime Minister announced that there's going to be a national Drug and HIV Council that's going to be set up. Basically, it's going to replace the National AIDS Council. And we're currently working with them to try to get the terms of reference for that council, and hopefully it's going to go ahead soon. 2018 again, the new Minister of Health announced that methadone substitution therapy is no longer going to be done outside of police stations. It's going to be done in primary healthcare centers. They already started it. We've done, basically there's 42 distribution points, 42 police stations where it's being done, but already 7 of the points have moved back towards primary healthcare centers. They're doing it gradually, and they're going to potentially change the hours as well. And maybe we're looking at takeaway home doses, hopefully, if we can keep pushing. One other thing that happened as well is that there's a center for under 18s who are using drugs. Last year in Mauritius, there was about 1,000 young people who were admitted in hospital for the use of new psychoactive substances. We'd been advocating for that since 2011. Well, I started advocating for it since 2011 when I went back to Mauritius. But basically, it's now that they opened this center for under 18s, and it's got 10 beds, but it's a start, and hopefully it will gradually come up. But at the same time, the Minister of Health, during his speech, which was done a couple of days ago, no, actually last week, he started using compassion. He started using drug users or human beings instead of criminals, which echoes what the Prime Minister started saying as well at the conference where he met Sean, who was really angry with him. And basically, I want to just build up on what Steve said this morning. And this is actually in a report that was published this year in July. It's a Commission of Inquiry on Drug Trafficking report. It's the first report in Mauritius where it's actually stated that all political parties, whether they be in government or in the opposition, should make it a point to avoid populist politics and unrealistic promises to turn Mauritius into a drug-free island. It's the first time that an official report has that, so I've been using it to try to make people understand why we've been saying it all these years and we're not mad. So basically, the lessons learned. Community involvement is essential if you want to develop policy and you want to push for reform. Advocacy and innovation challenge harmful practices and policies as well. It's very important to be able to create the spaces of dialogue and to influence the context of things, especially in a harmful environment. Building alliances and networking is extremely important. So you need to connect with people like IDPC, people like OSF, ARASA, and Global Commission on Drug Policies. And capacity building of stakeholders, so different organizations working in the field of drug use, capacity building of drug users themselves so that they can advocate as well is extremely important. And the fifth and last thing is we need to be vigilant, because nothing is set in stone, and we are the perfect example for that. We were actually a champion in harm reduction for Africa, but because of bad policies, things went backwards quite quickly. And now we're pushing so that things don't change. And the dialogue we had around support and punish with different political parties was to ensure that when election time comes next year, they are aware of harm reduction, they are aware of sensible drug policies, and we can start the dialogue with whoever potentially will come into power next year so that we don't do what happened in 2014. And lastly, I'm going to finish with that. I'm wearing a really cool T-shirt, so if you want to look later. It's actually a campaign that Coalition Plus started at Amsterdam conference. It's just say no to the war on drugs. You can actually get that online. There's it's in French and English, and you can find the history of the war on drugs and what's being done in different countries, basically covering Burkina Faso, Mali, Morocco, and Mauritius. Thank you for your attention, and I'm here if you want to chat afterwards as well.